Now, talking about pharmacodynamics of this cardiac glycosides, we already said an increase in myocardial contraction that will improve cardiac output, improve circulation of blood and tube perfusion, then a decrease in conduction through the AV node. This is the homotropic effect that would also cause a decrease in chronotropic effect, right? So that was where I was, and I said therapeutic serum levels. Therapeutic serum level is 0.5 to 2.0 nanogram per mil for digoxin. Therapeutic serum level is 0.5 to 2 nanogram per mil, and 10 to 35 nanogram per mil, 10 to 35 nanogram per mil for Digitoxin. So this is therapeutic levels for Digoxin and Digitoxin. So to treat CHF, the lower serum therapeutic level should be obtained, and for atrial flutter of fibrillation, the higher levels are required. So we are saying that this is to treat CH. So this is the dose. This is somewhat what we consider for CHF treatment. For flutter or fibrillation, atrial flutter or fibrillation, we will consider the higher doses for glycosides. The lower doses to regulate heart failure, the higher doses for both drugs to regulate flutter. So the Italic toxicity, the next point here is talking about the Italic toxicity. The Italic toxicity said overdose or accumulation of digoxin causes it. So this is called overdose. Overdose or accumulation. Accumulation causes it. What will be the signs and symptoms? We have anorexia, diarrhea, nausea and vomiting, bradycardia, pulse rate below 60 beats per minute, premature ventricular contractions, cardiac dysrhythmias, headaches, malaise, blood vision, visual illusions, confusion, delirium. I don't know if I can write all that here. I probably write the board. But we said some of the symptoms we find here. Symptoms of Italic toxicity. We have anorexia. What's anorexia? Diarrhea. We have diarrhea there. We have nausea and vomiting. We have bradycardia. So this is less than 60 beats per minute. Normally, because the person has heart failure or CHF, the heartbeat will go up. The heart rate increasing or heartbeat going up is a compensatory mechanism to, in a way, to augment for the reduced stroke volume. So it's like it should beat stronger and slower. Now it's beating faster and lesser force. Do you get now? So that's really what will happen. So once the beat is lower than 60 beats per minute, better has bradycardia here. So we have, I mentioned premature ventricular contractions. So the contractions are not normal, they are not proper. Cardiac dysrhythmias. So in a way, the drug we want to use to treat the condition is also producing that same condition as a side or adverse effect. cardiac dysrhythmias, headaches, malaise, blood vision. I didn't say blurry visions, visual illusions, confusion and delirium. So these are some of the signs of glycoside toxicity, digitalis toxicity. So we have all of that there mentioned. So note, the anti-dysrhythmic phenytoin and lidocaine are effective in treating digoxin-induced ventricular dysrhythmias. So most likely, we're saying that when a person has a digoxin-induced ventricular dysrhythmia, that's more or less person has digitalis toxicity. So let me put it there. Note, phenytoin. We'll talk about this more. And lidocaine are effective treatment for digoxin-induced ventricular dysrhythmias. So phenytoin or lidocaine can be used to treat digoxin-induced ventricular dysrhythmias. So that would be that you could use to treat digitalis toxicity. Okay. So right now, what I'd like to talk about would be your cardiac antidotes for cardiac and digitalis. Antidotes for cardiac and or digitalis glycosides. Antidotes for cardiac antidotes. For cardiac or digitalis glycosides. So antidotes for cardiac or digitalis glycoside, we have that digitalis toxicity may result in first degree, second degree, or complete heart block. Digitalis toxicity may result in, we'll speak about this later. Digitalis toxicity may lead to first degree, second degree, or third degree heart block. So the time toxicity can lead to first, second, or third degree. The third one is what called complete heart block. So digoxin immune FAB, FAB, example Ovine or Digibind, may be given to treat severe digitalis. So this drug can be given, or this medication can be given to treat digitalis toxicity. Is given as an antidote This can be given as an antidote for digitalis toxicity. So how does it may be given to treat severe digitalis toxicity. This agent binds with digoxin to form complex molecules that can be excreted in the urine. So what does it do? It will binds to digitoxin or digoxin, binds to digoxin to form complexes, to form complex molecules that are now excreted, in urine. So this is how this works. Digoxin immune fab in cases of what digitalis toxicity can bind to digoxin and form complexes that would be available to be excreted. So the next part here, so I think we should stop here for today. We stop the video.